like. So you can see I have a case here. I use the typical case that we all know that we can be familiar with. Um, and then we can try and see if we can answer this question. So they give you this case, bunch of information, very scary. So you should try learning that now. Very, very scary. You see that. Why do I need all this information? I just need an answer, one word to go. No, take your time, read it carefully, and underline keywords. I call them the buzzwords. The same thing. So we have a case in front of us. So we got to find the buzzwords. So we have a 16-year-old. So I'll underline my 16-year-old with known diagnosis of what? He has diagnosis of insulin-dependent diabetes. Was brought in by the mother with a complaint of fatigue. So he has fatigue, weakness, abdominal pain for 4 days. So they went to the emergency room for 4 days. Symptoms began after 2 days of runny nose. So he had runny nose. He has not been using his insulin, so not using insulin due to illness. So he's sick and not checking his finger sticks for 3 days. He has been going to the bathroom frequently, so he's making a lot of trips to the bathroom. So that's the situation. Then they've given you vitals. His temperature is a little bit high. The blood pressure, borderline hypertensive. He's tachycardic. His respiratory rate is 22. He's breathing 29. He's breathing fast, but he's still sitting 97%. How does he look? So this is real life. He look weak, dry mucous memory. His skin turgor is tainted, and a capillary refilled. Is greater than 3 seconds. So these are all the information. Then they're giving you a lab work. Okay. His sodium is 134, potassium 5.5, BUN 40, creatinine 2, and then ketone is high. Okay, so they've given you the normal value. This may be 15 here, giving you a normal value. And so what do you want to do? So this is what they've given you, all the information. Stay back, synthesize the information, and then you move on to the next question and see what they're asking you to do. But before you start answering the questions, sit down and say, what is wrong with this patient? It's type 1 diabetes, okay? Don't answer the question. Just analyze the question, and the time you spend to analyze the question is the same time you see that the rest of the answer choices will be easy. Type 1 diabetes came in with abdominal pain. That's my keyword, buzzwords. Okay. So let me use this so that I can show you guys text. So we have type 1 diabetes. And it came in with abdominal pain. He has symptoms of dehydration, mucous memory, all those things. Polyuria, so he's going to the bathroom a lot. And symptoms of dehydration, tachycardia, hypertension, all of them. He had a sick day problem, and he has no insulin. Okay, so I've synthesized everything, and all his lab work tells me, and he has ketone in his urine. What have I done? I've made a diagnosis. So I've made a diagnosis based on this. My diagnosis is DKA because the patient is a type 1 diabetes. So this is my diagnosis. I have a DKA because abdominal pain, dehydration, polyuria, sick day, all these buzzwords telling me this is a DKA. I'm reading all this information. All this information they've given me, I make my diagnosis, and I'm taking this with me wherever I go. I'm not leaving it. It's my friend now. DKA, let's go. So, and then they will give you this. Okay, so the first choice is say what? Um, you have your first choice question. The next priority diagnosis. So what is a priority diagnosis is, so there's a space here you got to fill in based on what? This. So in order to get this answer right, this one you may not get credit. If you choose the wrong diagnosis and right diagnosis based on wrong information, you won't get credit. So this is where you get everything right. So each is it HHS? Well, based on what we know, no, this is not HHS. Is it DI? No, it doesn't look like DI, even though it's having high urine output. That's not a DI. Is it SIDH? No. And so we know it's DKA. Based on this, what do you think? Is it creatinine that is high, potassium that's slightly high, ketones, or sodium? It's because of ketones. So you make the diagnosis based on this and that. So this is where they will score you 1 out of 1 or 0 out of 1 because you choose right diagnosis, but reason is wrong. The next one, they can give you a table. Is clinical. When you go to the floor, you see these table charts. You got to read X-ray. This, so they're trying to get you ready for that, but they're trying to play games with your mind. It's the same thing. Just focus. It said, "This is the way I know. Everything I know about DK, I'm bringing it, no matter how they present it, either in the table form or just regular question." What should the nurse expect as initial management? You know what the management of DKA. Initial management is IV fluid. Give the patient is dehydrated. If you give them fluid, you will stop the cycle of the metabolic acidosis that is occurring. And therefore, just give them some fluid. But what fluid do you give them? D5W? No, you don't give them. You have to give them isotonic fluid. So this, no. Insulin, no. If you give them insulin first, this is the problem. Insulin is the only thing that moves potassium inside the cell and glucose inside the cell. These people are lacking insulin, therefore their glucose is high and then their potassium is also high. When you give them glucose, insulin initially, it will move the glucose and potassium inside the cell. But this is going to worsen the already problem that is occurring. You're just going to worsen it. And therefore, the initial management, the whole thing that they having problem with is diuresis from the glucose. So give them some fluid and fluid and fluid before you give them insulin. Therefore, this is the right answer. You replace their potassium, but not right now. Number one is initial diagnosis. Then they will give you this kind of question form. It's intimidating. They will underline. You got to underline it, and they will tell you which one is basically based on the question. So they've given instead of the 5 choices they usually do, and you have to pick one. It's the same thing. They give you in the sentence form. Click on the highlighted information to indicate complication of the primary diagnosis. What is the complication of primary diagnosis? The patient has a DKA, and what are we seeing at the complication? Patient is getting dehydrated. So we're looking for things that tell me is a complication of the DKA. So diagnosis of insulin dependent diabetes, no, it's not a complication. So this is not it. Fatigue, weakness, yes. So this is a complication. He has been going to the bathroom frequently. Yeah, he's peeing a lot. Dehydration. Okay. Dry mucous memory. Good. And a capillary refill greater than 3 seconds. Good. So that's dehydration. So it's the same thing. It's like SATA form where you got to choose which one is consistent with the diagnosis. It's the same thing. They're just playing trick with your mind, but learn how to read information and weed it out. I did not select this one, but they can select tachycardia, respiratory rate of 29. All of them is consistent with the complication from that. So that is the way you answer this kind of questions. And this is the way they present it. I feel like it's fair now. It makes sense. You're seeing things that you're supposed to see, and it's like you're playing game, but it's nice way of presenting information. Um, and the next one, then they have this drag drop thing that is a little bit fun, but I think I like that one. Um, so drag two actions. So you got to take two actions, two factors the nurse should monitor based on primary diagnosis. So the way to do this is there is a presumptive diagnosis. And the presumptive diagnosis, they've given you four options. Which one is it? Is he sorry, this is HHS? Is he DI? Is he DK or SIDH? Our presumptive diagnosis was DKA. So you got to drag this DKA here. I couldn't do it. So you have to drag it all the way here. It's a PowerPoint, so it's a little bit different. So I will write it. So this is DKA. You put DKA here. So this is draggable. So by my slide can be dragged. So you pull your cursor, you pull it all the way here, and then it will take it. Now, after you make the presumptive diagnosis, look at the actions. What should the nurse do? Should the nurse give the patient oral insulin? I don't think it's a good idea. Regular diet? No, no in the DKA. Cardiac monitoring, I think is good. Its potassium is high. It's like 5.5. And then patient is dehydrated, is lethargic. When you controlling you correcting the problem, they can become hypokalemic. Therefore, cardiac monitoring can go here. So cardiac monitoring. And so you pull it and you drop it there. Another action, strict I and O. Yeah, I got to make sure I'm checking the I and O. So that's my answer. This one. Giving them bicarbonate, sodium bicarbonate, no, that's not a good idea. Then what do you monitor? Potassium, yeah, I told you, your potassium goes down. When they come in initially, potassium is like, it can go to 5 to 6 or something because there's no insulin to push potassium in. But after you start giving them insulin, it pushes the potassium inside the cell. So even though the potassium may be normal, you still have to monitor. It will go down. You have to replace potassium. So, okay. So I'll monitor you. Q1 glucose check. Yeah, you got to check their finger stick. They'll be using terms that normally used on the floor. So every 1 hour glucose finger stick, yeah, you got to monitor their sugar to make sure if it goes below a certain level. I know they come in with DKA. You don't want them to drop their glucose too low, otherwise they become hypoglycemic. You have them on insulin, so you have to watch their glucose. It get to a certain point, you have to give them D5W. You have to give them sugar. And that is when their sugar finger stick get to like between 200 and 250. You should be ready to replace their glucose. That's why you got to check the monitoring carefully. So this is finger stick here. Oral intake. Well, I don't want them to eat right now until they have corrected the acidosis. The temperature, I know he came in with a fever of 101, but it's because of the problem. Okay, so because of the DK. So that's the way this question, and it's fun. It's like you're doing a video game. And this is the way. It's just same thing, learning how to use information and putting it together. Drop menu. You've seen this before when you fill in forms. Yeah, sometimes you got to drop menu, pick, go down. That's the same thing. And finally, the last one, they can give you something like that. The next, you expect which additional findings. So this is your traditional SATA. Select all that apply. It can give you and mix it together. They can grade this by each level. So I did not state it, but maybe if you get this right, whether you get it wrong, you won't get a point. So let me assume, let's do it like each level as a point. Okay, so you need 1 point here, 1 point here, 1 point here, 1 point here, 1 point here. It doesn't matter whether you get one wrong. If you get one line wrong, you get 0, but the rest you get it right. So this is not the traditional SATA. So I've made it such a way that you get 1 point each level. So what do you expect? They are in ketoacidosis, and the pH should be less than 7.35. Okay. So this one is expected. So that's what is expected finding. Rapid deep breathing. What is that? Because they are acidotic, they want to, that is metabolic acidosis. You correct metabolic acidosis with respiratory alkalosis. You just change it. Metabolic go to respiratory, acidosis go into alkalosis. And therefore, what is respiratory alkalosis? You're trying to blow up your CO2. So blow out your CO2. How do you blow out your CO2? You increase your respiratory rate. So you increase respiratory rate. So they do something we call deep, rapid breathing. And that is Cushman breathing in order to get rid of the CO2. So this is good. A CO2 of 55, based on what I told you now, CO2 should be lower. It should go probably 30, from the normal value of 40. So it should go down. So this is unexpected. But if you choose expected, you lose a point there. So let's do as if I choose expected. Fruity scent. So they will smell like ketones. So that's the ketone body they form. So they smell like fruity, like fruits basically. So I choose expected. Urine specific gravity of greater than 1.031. You have to know your urine specific gravity because that's a lab work. So it's 0, the normal is 0.03 to 1.030. This is the low level, this is the upper level. Anything greater than this 1.031 means urine is concentrated. For these people, they're having diuresis. See, their urine cannot be concentrated. It will be like a lot of fluid. So they'll be losing all the, it's not just fluid, it's mostly, there's glucose in it, but they will lose a lot of water. So diuresis, okay, osmotic diuresis. So I would choose that way. And polydipsia, if because they dehydrated, they want to drink a lot, and so they drink, they're very thirsty, they want to drink. So you think it's diabetes problem, but it's because they are in DKA. So this is I'm choosing this as an example just to show you how they're going to grade you. So they come back, they said, okay, this is right. Rapid deep breathing, okay, this is right. You get 2 points. This is wrong. So fruity, you get it right. Okay, and this one is right. And polydipsia is you choose wrong. You choose the unexpected here. So you have 1, 2, 3, 4. So 4/6. So you get a point, 4 points out of 6 points. It's not the original SATA. If this were the original SATA, you have to answer everything right. If you mix one wrong, you lose all the points. So I think they're being fair